All right. Well, I decided to make one of these videos that I've seen on YouTube and Facebook and mediums like that, kind of about my experience with my neck pain, nerve pain, kind of how I got here, a little bit about myself, and kind of how I got to this decision, the steps I took, kind of my thought process, and kind of maybe um, just about my treatment plans and kind of what I may expect to go forward, and maybe go into a little bit about why I decided to do a cervical disc replacement um, rather than a fusion or conservative treatment. So um, anyway, my name is Wojciech. Um, and I guess I should preface this to say that I'm not a medical professional by any stretch of the imagination. Not yet, at least. Hopefully, attending nursing school pretty soon, but I have no experience in healthcare. So whatever you hear in this video or any future videos that may follow up with this, take it as just a regular old person that has talked to a couple doctors and has done maybe a little Googling, which means absolutely nothing. But I just wanted to preface this video by saying that. So, kind of how I got to this point. I'm 30 years old. Haven't mentioned that. So, 30 years old. I'm fairly healthy and active. I do a lot of running, some biking. I've done CrossFit for a year or so before. I referee soccer. So that's a main thing that I do. It's how I mainly stay active, and most of my training is focused on that. I've done that for 12 years now. So pretty active lifestyle, I would say. So how this kind of came about is about maybe 4 or 5 years ago, I just started getting random neck pain, just like a normal strain. Didn't think anything of it. It's just something that's kind of persisted. Didn't really do anything to address it. Wasn't really worried about it. It kind of progressed to the point where in late 2018, so roughly about 2 years ago or so, I started getting some tingling and numbness in my pinky and ring finger on my left hand. And I thought that was kind of weird. Thought maybe it might go away over time. So, me being in my mid 20s and still stubborn, I didn't think anything of it. So I just kind of let it go. And I want to say roughly in about a year ago, I started getting some tingling and numbness in my thumb. And I was like, all right, this is really weird. I should really maybe do some research on it and see what's going on, what I should do. And I didn't really address it. I did some Googling, probably some nerve impingement, but I've read that it can go away over time. So just keep an eye on it, and hopefully it'll kind of resolve itself. So I let it go for a little bit, and then I was having it for quite a bit of time, to the point where I recall jump roping I was seeing a personal trainer, in this winter. This was about December, January, and I saw myself jump roping in front of a mirror, and I saw that my left shoulder was about 2 or 3 inches above my right shoulder. I was like, oh, that is not good. And kind of just seeing that visual just kind of struck me like, you know what? I need to finally really get this taken care of and see someone about this. And so end up finally scheduling an appointment with a doctor. I saw a neurologist at first. She advised me to get an MRI done. I believe it's called a EMG. I think it's like a nerve conduction test. Don't hold me to that, but it's kind of seeing how proper my nerves are working, if there's any sort of blockage or some sort of issue with my nerves and how they're firing to my muscles. So I got those things done, and the MRI was quite shocking, because I wasn't really expecting that severe of a report. The tech afterwards was like, I can't tell you what the results are, but make sure you go see your doctor. I'm like, oh crap. So the results were that I had 3 disc bulges and then 2 disc extrusions. So they're essentially severe herniations where the inner gel of the disc kind of exited the outer fibrous part that's holding the gel-like substance of the disc in place, and that was impinging on my nerves, which it explains why I was getting all this numbness and tingling. So I got the MRI report and went back to my neurologist. And she suggested that I make a couple appointments with surgeons for possible cervical intervention, because she saw the report and the images, and it's quite severe. So I ended up making an appointment with a neurosurgeon, as well as someone who I thought was a surgeon, but actually ended up being a PMNR, pain management and rehab doctor. So the neurosurgeon that I went to see for a consult suggested, hey, because you don't have any weakness, it's just some nerve tingling, and it's not really affecting you day to day, that maybe you should go do some PT work, treat it conservatively, and see where you go from there. So I said fine. And in the meantime, I also saw the PMNR doctor, and he suggested conservative care as well. He was kind of surprised looking at the MRI image. Let's see if I have it here on my phone. There's other images, but you can clearly see, if I can get this to pull up. Oop. I'm new to this whole technology thing. So you can see right there, C5-C6, pretty severe. It's kind of clear. And I have another view where you can see actually at C7T1, which is right there. That's the other disc extrusion. So those are pretty severe. My PMNR doctor kind of joked that he was asking if I was in Fight Club. I told him I couldn't tell him that. So in any event, he prescribed PT, conservative care. I think he prescribed me a steroid pack to kind of help with the inflammation, and then so I started doing PT. I was doing that 3 times a week for months. This started in February, March, and after a few months of PT, really after the first month of PT, my nerve pain was gone. I didn't have any numbness or tingling, no weakness. I was doing a lot of like cable work to build up strength in that area, and I felt really good. The only thing that was bothering me was my neck. I was just really always tight, always wanting to crack it, and it was just really bothersome. So I continued going to PT, thinking that it'll help over time. Maybe it'll work itself out, whatever that means. So what I ended up doing is trying out the epidural shots, to kind of, again, target the inflammation more directly with the epidural, since it's going directly into the disc space. The doctor kind of suggested going to C5-C6 with the epidural shot, and then hoping that actually that the injection will kind of rise up to C5-C6 to help that area out as well. After the injection, it helped for a couple days. I felt pretty much 100% better. I was moving around spry. I was moving my neck. I was feeling good, and then slowly kind of deteriorated over a week or two to the kind of what baseline neck pain I was having at that time. After a follow-up, he said, we could try it again. We got the right spot because you were feeling good, so we could do it again, kind of see where that goes. This might knock it out. If it doesn't, you could try a third one. So kind of play it by ear. So I scheduled a second epidural. I did that in, I believe it was early July. I don't remember the exact date, but probably about 6 or 7 weeks ago. And that helped for about 5 days. I was feeling nothing there. It was great. I felt amazing. And then again, it slowly deteriorated, and about I guess it was 2 weeks after that second shot, I was visiting family, and about 3 hours from here. And on the last day, I started getting, my trap was really tightening up, where just from the morning, it was a Sunday, from Sunday morning, just progressively throughout the day into the early afternoon, just getting tighter and tighter and tighter, where to the point where I brought with us a TENS machine, so a little stim machine. I brought that with us on this trip. We were there for 2 or 3 days, basically for the weekend. I brought it just in case, and we're just hanging out on the patio, and I whipped out the stim machine and hooked that up, and I was leaning back and trying to stretch, and it was not good. We left that night, and I couldn't drive us back home because I was so tight and so stiff. So my wife ended up driving us back home, and that night I just couldn't sleep. I think I took a Valium. I think I took 2 Valiums, and we bought like menthol patches to kind of like help soothe the pain. Like we were just like throwing the kitchen sink at it. I think I might have taken an Oxy too. I don't know. Like we were throwing the kitchen sink, honestly. And so the next day, eventually, I didn't sleep much that night. It got even worse the next day, to the point where I couldn't roll out of bed. I couldn't move. If you can imagine me laying down, if I was to try to lift my head up like that, I was screaming in pain. It was as close to 10 out of 10 pain as you can picture. So I made an appointment with my pain management doctor to see him as soon as possible. He wasn't in that day, but he had availability the next day. So I ended up having to drive myself to the appointment, which was 45 minutes away. And after seeing him, he kind of told me, like, at this point you gotta get this fixed. Like the conservative route's not working pretty much anymore. It's too angry, as you like to say. Like my body's just not responding to whatever treatment I was throwing at it. So he referred me to a surgeon at his practice, and then I also went back to see my neurosurgeon that I saw previously. So my first appointment, I believe, was the next week. Actually, rewind that. While he prescribed me to go see the surgeon, he also gave me some scripts for the meantime. Gave me another steroid pack and a muscle relaxants. So that day, the muscle relaxation really well worked really well. The muscles kind of loosened up, and then the next day, once the muscles relaxed, it was this. I can't even describe the amount of excruciating shooting pains down my arms that I've never felt before, where I would feel it all over my arms. I feel it in my deltoid, my tricep, my forearm. It got down to my thumb. Eventually, my thumb has become, I want to say permanently numb, but it's been numb for the past 2-3 weeks. No matter what position I'm in, whether I'm standing, sitting, walking, laying down, it doesn't matter. It's just always numb. And this nerve pain prevented me from doing anything. Right now, I'm sitting upright, uncomfortable. I still feel like this shooting pain a little bit. It's kind of pins and needles, like someone's grabbing onto my muscle. And I have a ton of weakness, but I'm able to sit upright and kind of make this video. Whereas the past 3 weeks, I've literally been laying down all day. And when I say that's all I do, that's all I can do, was lay down, whether it was in bed, or I made myself like a makeshift cot on the floor so I could watch TV as I'm laying down in the living room. But if I were to try to stand up to do anything, even to walk around or walk my dog or try to make myself breakfast, I'd stand up for no more than 5 minutes and having to run back to bed to lay down, because that's the only relief I can get, is just laying down in bed. And that kind of experience of just laying down all day, not being able to work or referee or run or train or anything, help around the house, I couldn't do anything. That kind of solidified that, like, as much as I didn't want to have surgery, that it was probably the right decision to make in this point in time. Like, I tried the conservative route, and I tried it for 4 or 5 months, and I was progressing, but this kind of setback was worse than what I was feeling prior to doing this conservative care. And I knew I had to do something. So I kind of had my mindset that, I probably will have surgery. And so at that point, I had this appointment first with my PM&R's partner, I guess, at the office. He's an orthopedic doctor, specializing in spine, in spinal care. So he's well known locally here. So I felt pretty good if I decided to go with him. He saw my MRI. We ordered another MRI to kind of compare. Ordered X-rays, and there's some degeneration, obviously, with the disc, and the MRI ended up being worse than previously. If I could pull it up to show you this. Here we go. That's my updated MRI. It's kind of hard to see, but it is worse than my one from February. So almost six months later. So at that point, I kind of, like I said, it's pretty sound having surgery. It's a matter of whether going with a fusion or a disc replacement. He suggested the disc replacement over the fusion, and his main concern with having a fusion was because I had a disc extrusion at C7-T1. It's not adjacent, but it's next to the adjacent level of the one that's giving me problems, which is C5-C6. That could over time deteriorate that 6-7, and because it's so close to 7-1, it could, in theory, affect that down the line and put additional stress on C7-T1, where I'd have to have additional surgery on that at some point down the line. he thought that I might be a really good candidate for disc replacement. So I took that opinion, and then I decided to go see the neurosurgeon that I saw back in February for his opinion. And he's also well known down here. He is a neurosurgeon though, so I do consider his opinion very highly. And he said if he was in my shoes, if this was me, this is him talking. If this was me, I would do a fusion, because it is permanent. So there's no, at least at that level, there's no worrying about the disc, that area, failing or having to a revisement because the disc failed or whatever. And the disc replacement doesn't have that long-term study, like with research, compared to fusion, which has been around for 50, 60 years. And at least in the United States, the discs have been around for about 15 years or so. I know Europe is a little longer, I think 20, 25 years. But so those studies are slowly coming in, I think. So eventually, I decided I wanted to get a disc replacement rather than a fusion. And I think there's 2 points. I think, at least in my experience, I think the movement aspect is significant just because of my active lifestyle. I don't want to limit my mobility if I can help it. Me being active, and especially being as a soccer referee, where movement is pretty important. It was an important factor for me. I was worried about the adjacent levels deteriorating if I got a fusion. I don't really, because of what's the fix to a fusion for me is to have another fusion. Okay, what about that one? Severely hurting the adjacent levels. Well, it's just to get another fusion, and it's like, at some point I'm gonna be all locked up, and I've tried to avoid that if I can. Being that I'm 30 years old, I have hopefully another 50 years left in me. So the chances, I feel like, of having another fusion, if I were to get this disc this disc removed and fused, and the vertebrae fused together, I feel it would be very high over the next 50 years for the adjacent levels. And that's not ideal, because I want to live a long and active life, as much as I can help it. So that, and at least if I were to get the disc replacement, if for whatever reason it fails, or if there's some sort of issue, down the line, if it fails 10, 15, 20 years down the line, and then I fuse it, well, at least I got a good solid 20 years of, a full active life, and, and maybe I'll still be fine, even at 50, still active, even with a fusion, if that ends up being down the line. But for me, it's trying to, I think, at the end of the day, trying to prolong, my youth as long as I can. And that's kind of, I think, what was the main driving, deciding factor as to going for a disc replacement versus a fusion. That's kind of the reason why I did it. There's nothing else to that. I think nothing more to that. The whole like old school, new school thing, I don't really care about, because fusions are very, very successful for what they accomplish, from what I've read and looked into. But I'm willing to go for the disc replacement and hopefully preserve as much natural, can't really call it natural if I'm getting a disc replacement, but as much of a natural movement and life as I can. Kind of because this video is just like long-winded. I'm boring myself talking, I feel like sometimes. So as far as just like the process, I'm actually scheduled to have surgery tomorrow, September 1st. I just got the call a couple hours ago that I'm having first start, so I will be arriving at the hospital at 5:30. I believe surgery is at 7:30 in the morning, and it's going to be outpatient, particularly because it's COVID, so they're not admitting patients. I think typically they actually would admit me for overnight, but being that it's first start, and the beds are kind of full because of COVID, it's going to end up being outpatient, which I'm okay with. So just very briefly how kind of the last few days have been. Yesterday, Monday, August 30th, I got my blood work done. I got my COVID test done as a rapid test. That came back negative, thankfully, because I think I would have cried for quite a while if that came back positive, because I don't want to delay this any longer. I did what else they do? COVID blood test, an EKG, just because there's a slight abnormality from it's just I think my normal heart rate and heart kind of the conduction system is just like slightly off, like a T wave. So they just wanted to have that, make sure it's okay for surgery. And there's one other thing I can't remember. Oh, and swabbed me for MRSA as well. So I got that taken care of. Got me scheduled, and I think that's about it. I don't really have too much to add. I plan on going on grocery shopping tonight to kind of get some yogurt, ice cream, popsicles, and I don't know what else. Anything that's like fluid-like that I can eat. That's kind of what I'm going for, because I've heard that the swallowing and the neck pain is going to be not fun, especially for the first couple days post-op. But I think that's about it. I don't think there's too much more to add. This is going to be my first YouTube video uploaded, so I'm wondering how this is going to turn out. So hopefully upload it at some point tonight, and then I'll be going in about 12 hours for surgery. I'll try to update when I can, if I remember to update. Maybe I'll try to do one, the night of surgery tomorrow. Maybe I'll see if I can, if I feel good. Maybe I'll upload a short update. So I'm not sure what I'm kind of planning on with this. If I can be a support for someone that's watching this video and maybe subsequent videos, then that's great, because I know watching some people's videos on YouTube was a big help for me, and kind of to reassure me that the decision that I made was reasonable and logical, and all the emotions that I'm feeling is completely normal. Like this past few weeks, kind of the realization I'm gonna have surgery was a little bit shocking, but at the same time, like, I haven't felt any nerves or kind of any heavy emotions about it. It was just like, yeah, well, I gotta get this fixed at this point. And today's kind of the first day where I'm like, okay, well, this is a surgery, and I have a little nerves right now, so I'm trying to keep them at bay, trying to hydrate as much as I can, eat some good foods to kind of make sure I feel good going into surgery tomorrow. And yeah, so if I can be a help to anyone, then this is awesome. Then I'll try to make videos for myself too, because this might be something that I like to look back on if I'm looking, if I'm feeling down one day and about how I'm feeling, then I can kind of reflect back and see where I've come from, and where I'm going and how I'm progressing. And so like I said, if I can be a help to anyone, feel free to message me or comment below. And I'll try to get back as soon as I can with any information, and if I can help in any way, then please let me know. So with that, I think I'm going to sign off, and tomorrow I will be bionic. So, all right, see ya.